Okay, numbness, burning, stabbing pain, and loss of balance are all symptoms of peripheral neuropathy. If you think you might have peripheral neuropathy, but you're not sure, I asked Dr. Matt Thomas, DCBC and founder of 360 Neuropathy and board certified in neuropathy, what you really need to know. We are here at 360 Wellness with Dr. Matt Thomas. He is the founder of 360 Neuropathy program. Thank you so much for having us out.
Oh, thanks for coming in, Hannah.
Of course. Okay, so today we're talking about peripheral neuropathy and specifically the amount of medications a lot of patients take. Do you think taking all these medications is the best treatment for neuropathy?
You know, Hannah, I don't. Typical medications that are prescribed for neuropathy, gabapentin, Cymbalta, Lyrica, amitriptyline, while they're not opioids, they're in their own classification. Typically, these medications are prescribed for fibromyalgia, seizures, anxiety, and depression. They do come with their own host of side effects. So although they aren't opioids, they're not a good long-term solution for taking care of neuropathy.
You know, one thing we hear about so much is medication abuse, especially prescription. Do you think this contributes to that?
Absolutely, absolutely. If not taken correctly or as prescribed, or let's say long-term use, I mean, they can cause a lot of damage. So yes, absolutely.
So we've established there's a lot of negatives or side effects to these medications. The question then is, why are so many people being prescribed them and taking them?
That's a great question. And they do give temporary relief from pain. So you have to understand that. People do get some temporary relief. They may even help someone function on a day-to-day basis, but they are not a good long-term solution, especially when it comes to neuropathy, because they do nothing to reverse the nerve damage caused by neuropathy. Meanwhile, while people are continuing to take these medications, the condition's just getting worse and worse.
Okay, with that information, what should you say to folks with neuropathy that are taking these medications or have been taking them for quite a while? What would your advice be to them if they're concerned about being addicted?
Sure. Well, I wouldn't just stop taking the medications. I would talk to your physician and see if he or she would be willing to take down the dosage. That's the first thing I would do. But more importantly, people need to be aware that there are alternative means that actually reverse the neuropathic process, reverse the damage caused by neuropathy. If you give the body what it needs to heal, it will heal. So at least up to a certain point. If it crosses a line and you wait too long, then it becomes very, very difficult. But you need to explore those alternative measures because the body will heal itself.
And that's really one thing that you've set out to do here, is to really treat the cause or the source of neuropathy as opposed to just giving medication to mask the symptoms. So tell me a little bit about what you do out here.
Well, it's not a cookie cutter approach to care. You have to make sure you treat each patient as an individual. So number one, you have to determine the cause. Number two, you have to determine the severity, because it could be a vascular issue. If you're not getting enough oxygen and nutrients down into the nerves via the arteries, the body won't heal. You've got to stimulate the nerves to grow. Nutritionally, neuropathy patients are typically so nutrient deficient. If you don't address that aspect of care, then they won't heal. And these are just a few of the things. You know, x-rays and other diagnostic tests may show some different things. So you have to take it on a patient-by-patient basis and make sure you're recommending the best care for each person.
And because it's so different, I think information is power.